Hi there, everyone. Contrary to what I originally said in my discussion post, I've actually changed my mind and I'm going to be doing this analysis speech on immunizations. This is something that hits very close to home for me as I am and will be in the medical profession, both as an EMT and as a future nurse. This is kind of our first barrier of protection against many debilitating, horrible diseases. Over the past several decades, vaccinations have been a successful disease prevention method carrying a large amount of controversy. I first want to go into this brief history about where vaccinations came from, which is hundreds of years ago, Buddhist monks used to drink snake venom in order to protect themselves from deadly snake bites. In 17th century China, they used to smear cowpox on a skin tag in order to protect themselves from the smallpox disease. According to the Center for Disease Control and Prevention, there's about 25 different vaccinations that you can prevent deadly diseases with. Of those 25, measles, mumps, and rubella, hepatitis A and B, diphtheria, the seasonal flu, influenza type B, polio, rotavirus, tetanus, and varicella are all recommended for the general public. While the risks that are involved with these vaccinations can be kind of frightening, as well as the shot itself, the diseases they prevent are actually horrible. So, for example, influenza type B is a type of disease that is a bacteria in pretty much anybody. It can be as simple as an ear infection or as severe as a blood infection, which can actually lead to death. Mumps, part of the MMR vaccine, this can cause swelling of the jaw, inflammation of the salivary gland, otitis, deafness, and meningitis. Pertussis, one of the most common, is also known as whooping cough. It affects children, usually 6 months or younger. It can cause pneumonia, convulsions, apnea, and even death in some cases. Despite the severity of these diseases and their side effects, a common myth causes a plethora of uneducated controversy amongst the general public, parents, the government, pretty much anybody that has to do with these vaccinations. This all started from a study in the Lancet by Andrew Wakefield in 1998 that linked the popular MMR vaccine to autism. Shortly after he published this article in the Lancet in 1999, he immediately discredited any proof that this vaccine was actually related to autism. In 2012, there was a Cochrane systematic review that was published that said the MMR vaccine was unlikely to be associated with any type of debilitating disease such as autism, asthma, leukemia, hay fever, diabetes, gait disturbance, Crohn's disease, or any type of bacterial or viral infections. Through the use of vaccinations and their successful prevention tactics, the overall health of the public has actually improved pretty drastically. If you were born in the 1900s, you actually have a 1 in 10 chance of dying before the age of 3 due to illness or disease. Due to the increasing amount of health benefits these vaccinations give us, that those statistics have actually reduced to 3 in 500, and average life expectancy has actually increased about 30 years. So that's pretty good. According to the National Center for Immunization and Respiratory Diseases, the disease prevention benefits of getting vaccines are much greater than the possible side effects for almost all children. There are, of course, as with any type of medication, there are some main risks that are associated with such vaccinations. Many of them are minor, such as swelling or redness of the injection site, some minor bruising, and even some fever that could subside within 1 to 2 days of getting the vaccination. Preventable diseases such as the HPV virus, pertussis, MMR, they can all be easily avoided with routine immunizations. As I've said before, the risks associated with such immunizations is definitely smaller than the risks that are associated with these debilitating diseases that they are trying to prevent. Due to the growing research in healthcare and the abundance of vaccines, the overall health of the public has improved drastically. People's lifespans have increased drastically. Despite the major controversy, it is clear that the public health benefits of preventative vaccines greatly outweigh the rare risks associated with such preventative measures.